Hello, everyone. It's May 6th, Wednesday, and this is our briefing today. We got some really good news in that since Saturday, it's been since Saturday since we've lost anyone. We've still lost the 50 in our state, and we ask that you continue to offer up your thoughts and prayers to them and all their loved ones in every way. Before I go any further on that, I'd like to just tell you just this, and you'll see this flavor of this as we go through our report today in our briefing, but I've got to always tell you that I listen to all the experts. I gather all the information from all across our country, in fact, world. I listen to all the president's people, and all of us want nothing but the right decisions and to move forward in a way that is absolutely going to ensure our safety. I think, from the standpoint of the nation, that we're still going to experience some rough road. And from the standpoint of West Virginia, we've all got to remember that we are a state that was the highest risk state of all. The state of the most elderly, the state of the most chronic illnesses. And we can't forget that. I don't want to sit here and report to you that we have slipped back and we've got a catastrophe on our hands. And a catastrophe could be a hot spot where we lose 15 people or whatever it may be. We've lost 50 people, and that's terrible. But compared to everybody else around us, it's only a fraction. And it's only a fraction because of how good you've done, how much you've listened, how prudent you've been as great West Virginians, and how good you've done. Now, I want to tell you that the days ahead are not just quiet seas and clear sailing. The days ahead are going to have bumps in them, and we are absolutely going to try to stay on top of all the bumps that we possibly can, but we've got to remember, and we've got to ask you. Someone asked me the other day, are you concerned? You dadgum right, I'm concerned. Are you worried? You dadgum right, I'm worried. Absolutely we want to be smart, and we want to be protective of the old, and absolutely, first and foremost, look after them. But you've got to do it. You have to do it. You can't just push this to the point in time where you believe all's good, because this nasty killer is still with us right this second. And this nasty killer will take some of your loved ones away if you just don't listen. So please, get on about your lives and try as best you can, because we've got to restart. We can't just sit on the porch. We've got to restart. But as we restart, please just be as smart and as good as you've already been, and we'll get through this. We'll get through this as great West Virginians already have. Our week 2 and week 3, that we have our safer at home order in effect. We tell everyone we're not requiring you to open, we're allowing you to open. Our week 3 reopening plan will begin next Monday. Guidance for these businesses is on our website now. Now, let's go to something that we just discovered. I said before that as we moved through testing and we completed our testing of our nursing homes, we would go immediately to our daycares, and we would make it mandatory that we test all of our daycare staff. Now, in the beginning, we've had several, different staffs as they're trying to get back up and everything to voluntarily test themselves. We have had 4 positives on staff that have just come in from Kanawha County. Now, with that being said, the other thing is none of these people had any symptoms. We've been telling you that this is the way it is. It's the way it is all over the place and everything. You don't have to have symptoms to be contagious to many others. Now, So today, I am now issuing an executive order that as we've moved through the nursing homes, we're going to now move to the assisted living residents, and we're going to test all assisted living facilities in West Virginia. However, we're going to be in the executive order, you will see that it will be mandatory that all daycare staff be tested. Now, it is our hopes in every way that we can have all of our daycares up and going. We need them to be able to take care of our children as our workers go to work. There's no question about that. But we absolutely cannot risk anything to our children or anything that our children could maybe take back or whatever, or the interaction with our staff, with our parents or whomever it may be. So as that executive order comes out today, it will be for the assisted living, and it will be also for all of our daycare people, and hopefully we will move towards our daycares, first and foremost. I hope that all the daycare workers and people are with me and they understand, and they will be extremely cooperative, as I know they will be. I'm just seeing if there's any other notes that I may have here on that. No, I think that's enough. The other thing we are going to do targeted testing in our African American communities. I told you yesterday, and Secretary Crouch will give you a report on the details of all the stuff we've already done. I think, you'll find that we're looking at these communities and looking at them and doing the prudent type work that will enable us to ensure that we won't have critical problems in those communities as well. I want to talk to you just a second about the stimulus package and everything that's out. I haven't talked to you, about that for a while, and I'm only going to talk to you, at a high level on this. But here's the bottom line: the federal government is continuing to come up with rules and revisions of rules and on and on. Everyone knows we received $625 million, and then, which is all the money in the universe, and then sure enough, right behind that, another $625 million came, and we have in an account $1.25 billion. We're very, very hopeful that we're going to be able to backfill some of our lost revenues and everything with dollars from that, and we're going to be able to do things all over the place, whether it be counties or cities or whatever it may be. They just came with some new rules, yesterday and everything in regard to our first responders and firemen, policemen, all the emergency services people and everything. But as there begins to be more and more rollouts, here's the thing that you've got to entrust that you got a business guy that's here. You got a guy this is right in his wheelhouse. You got a guy that has told you these dollars are coming, and there's substantially more dollars coming. I met again yesterday with all the revenue people. I'm meeting again today with all the revenue people. We are working this from so many different angles, it's unbelievable. Not only are we working it in-house, but we're working it with others as consultants from out of house. And so in all of that, I would say just this: it is so easy. It is so easy. Everybody's got an opinion as to where you ought to spend the money. It's like everybody's running to the cheese. Everybody's got an opinion on where you ought to spend it. But I'm telling you, we're going to do the smart thing. We're absolutely going to, first and foremost, in all of our counties and cities, we're going to take care of our first responders, we're going to take care of our police and our firemen and all the emergency services people, and we're absolutely going to ensure that you are safe and being taken care of in the counties, and we're not going to run out and do something with dollars that the federal government is so kindly giving us and everything. We're not going to run out and do something with those dollars and deplete our dollars to where we would put you at risk. The other thing we're not going to do, we're not going to get in a situation where we bankrupt our state in order to do something else, and therefore then as our state dies, our businesses, our cities, our counties, everyone dies. So we cannot afford to do that in any way. And I guess the bottom line of the whole thing is just this. You've entrusted me to get you to here. Now you're into an area with dollars and stimulus and business aspects and everything, and that is truly right in my wheelhouse. And with all that being said, we're going to consult with the leadership on both sides of the aisle. We're going to bring everybody under the tent, and we're going to work towards a solution that is the very smartest and best solution we can get once we totally get and understand the rules. Now, the rules are changing, and it's changing nonstop. Everybody, all you got to do is turn the television on. Everybody knows the Senate's in session and the House is coming in next week. As soon as the House comes in next week, we'll have rules and we'll know so much more than we know right now. But I truly still do believe that we're going to be able to get through this with the assistance of the federal government. We are a state that was producing surpluses. We were not a state that had pension liabilities and things like that that everybody's trying to get paid for. We were a state that is only asking to backfill the loss of this pandemic. And so I think we're going to be okay there. I've got just a few other things. Workforce has now processed or has now received 170,000 unemployment claims. Over 15% of these require special handling due to filing or wrong type of claim or other issues. And I totally understand. I understand more now after going back yesterday and really getting pretty riled up about the whole thing and saying I'm just not going to put up with people being frustrated and us not doing any and everything we can do to be able to accommodate these people, because they have concerns and worries just like all of us, and I want them to be paid. And so with all that, though, we got to do it right, and there's guidelines we got to follow. And if we have a great amount of people that, that have issues with how they've made the filings, and we have to talk to those people and everything, when you're having to talk to 15% of 170,000, it's a big number. And so try to bear with us. We're trying to put everybody in the world on that to be able to discuss with you and get you through this situation. And I have directed Scott Atkins to get these done as quickly as possible. And if he needs additional help, all he's got to do is ask me for it, because I'll put whatever help needs to be in order to get this done. Now, today is Nurses Day. I have signed a proclamation declaring that and everything. Let me just touch on that very quickly and just say this. And again, all you got to do is turn the televisions on. This is just speaking from my heart. Do you have any idea what these great people have brought to us, and the lives that they saved, and the lives that, and the danger that they put themselves in? Do you know how tough it is to come to work and know you're dealing with this killer virus every day? And, and then all of a sudden you're going home in the evening, and your family's there, your loved ones that are so dear to you are there. Maybe a mom or a dad, is an elderly person that's there. Maybe they have chronic illnesses. Can you imagine the bravery that it takes of these nurses every day? So as you see them, please appreciate them. Please thank them. It's a National Nurses Day, and we're signing a proclamation today, and all it is just one more level of gratitude for all the great work that these heroes have done, and they're just that. So I thank them in every way. Also, I've just found out that it is National Interpreter Day, and we have two beautiful ladies here that have been doing the work for us here, and so there's just so many different things, that happen that we're very thankful for, and so we thank all those that are helping us in every way that they possibly can. Only other thing I have on my list, I keep going back to it over and over and over, and I can tell you that, you know, this is my job, and it's an honor to be in this job. You'll never hear me complain. It's an honor to have been with you on this journey through this really difficult time. It's been an honor to be your governor from day one, and I'm going to continue to do the very best of my abilities with the blessings of God above, in order to continue to take and make greatness within our state. Now, with that, I don't ask much. In fact, I've never asked anything for me. I don't want anything for me, you know, and in fact, my vehicle on the way down today, I had a flat tire, and so you know, maybe the duct tape on the bumper is causing my tire to go flat, but nevertheless, I would just ask this though, and this is an ask. I have asked you over and over, please help me with this census. I mean, you know, if you have a soft spot for me, please help me with the census, because sure as I'm sitting here, we will come up with lots and lots and lots of people not counted in our state, and I need you. I really need you to help me while there's still time to help me there. But that's all I've got today, and let me report on our graphs here just 1 second. Today our numbers were really good, really good. Today we've dropped below 1%. So if you'll put deposit, you know, on this graph right here, we dropped to 0.8 of 1%. So we're actually a fifth of 1% today. But if you'll notice and everything, our cumulative has dropped to 2.24. All that's just great stuff. You know, and maybe you could put the trend lines of the people that active recoveries versus the people that we're still treating up. You'll see, look at the blue trend line as it's even dipping even further down. And that's the active cases line, and that's really good. And look at the orange line as it's starting to even move up further, and that's the people that have recovered. Good stuff. Good stuff. Now, let me go back to one last thing. Please, my gut tells me there's still going to be a lot of rough storms in front of us. My gut tells me that absolutely you can make the rough storms become maybe a steady little drizzle, you know, and so please take heed. Please wear a mask when you go out. Please absolutely look after the elderly. Please wash your hands and do all the things you can do. Keep your distancing. Just bear with us just a little bit longer. You've been on a journey, and I know the journey's tough, and I know it's terribly inconvenient and everything else, but we don't want this thing to bite us. And absolutely, this thing can turn around and bite us really bad. So stay with me. I really appreciate you. Thank you.
All right, thank you, Governor. Now let's go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. I have a couple of things to highlight today, one of which relates to what the governor talked about earlier related to daycares. The National Guard Child Development Center was one of those facilities in Kanawha County where we identified an individual of the staff who was asymptomatic, had no symptoms whatsoever, but thanks to the partnership with Kanawha-Charleston Health Department and the testing that was done on the daycares in Kanawha County, we identified an individual. So we're taking the appropriate action. That individual is isolated, fortunately, and going to the governor's other point, for a couple of weeks now, all of our staff have been in the appropriate PPE when dealing with our children. So we believe that we have done a good job of reducing the potential threat from this. But it's an important point for all of us to remember why the team and the governor are recommending the many things that we do related to testing. We'll do a deep cleaning of the facility, and when appropriate, we'll open back up to take care of the children of our guardsmen. I also want to talk about a great event that occurred yesterday with the food bank in Huntington. The food bank in Huntington initiated a mobile food bank supported by the West Virginia National Guard, and 198 families were delivered food products as a result of that mobile food bank. We'll continue to work over the next several days, particularly in areas with Kanawha County and other counties doing the sanitization and cleaning processes and facilities that need to be addressed. And the last thing I would leave you with is I appreciate the governor's recognition of nurses on National Nurses Day. And I want to pay particular tribute to my wife, a nurse, and all of her colleagues and the nursing students that she deals with in her job. Thank you.
All right, thank you, General. Next, let's go to Dr. Clay Marsh, our coronavirus czar.
Thank you. I'd like to lead off and just join the governor and General Hoyer in thanking all of our nurses, both here in the state of West Virginia, but also in our country and our world. These heroes come every day to help other people heal. And I hope during this day and this Nurses Week that each one of you find a time to heal yourself. So thank you so much for your service and for your excellence. I want to comment briefly around what the governor has said during his comments, which I think are really, really important. You know, a lot of people have followed a lot of guidelines and worried about these coming, you know, from the readiness of states to be able to move forward on reopening. And we have seen some states that have had increases in cases and deaths related to, you know, the reopening process. And as the governor said, we know as people come back out together, this virus has not left us. And in fact, you know, people are at risk, and we heavily encourage our citizens to do what you've learned to do and add wearing a face mask or a face cover. And while many of our metrics are very good, and the governor's gone over those are metrics that really reflect what's happening today. But there are other metrics that we follow that give us a feel for what may be kind of brewing underneath, that we know that, you know, to express new cases and new spread, it takes about 7 to 14 days. And we also know, as the general said, that at least 45% of people will be pre-symptomatic or asymptomatic that will have the virus and be able to spread it. And another percent of people, up to maybe a total of 70% of people, will be undiagnosed. So more extensive testing, and particularly extensive testing of people that work with other vulnerable populations or that are members of vulnerable populations, or work in congregate settings where spread could happen very quickly from somebody who is pre-symptomatic or asymptomatic. That's really important as we look around the country, certainly nursing homes, meat processing facilities, issues around Veterans Administration facilities, rehab facilities, et cetera, are where we see a lot of the cases and the outbreaks, but also, unfortunately, where we see a number of deaths, and as well in vulnerable populations. And we've talked about the African American population as one, but there's also Latino populations and others. So the only other comment I want to make today is that we've followed another metric called the R naught, the R sub-zero, which really, as the governor has explained and I have talked about, relates to how much spread may a single person be able to do. And as we've talked about, that Germany with Angela Merkel has really followed this as the main frame, the main metric that she has used. And we, as the governor said, over the weekend, were #1 in the country, and that was at a rate of about 0.74. And the day before that, we were 0.76. Anything below 1 means that you basically stopped a single person from spreading it to another person, which implies that you've really kind of stopped the spread of the virus in your community. Well, 2 days ago, we were 0.76, which was reported yesterday. Yesterday's number came out a little bit after the press briefing, and that number was 0.83, which means that we're starting to see the potential that maybe the spread of the virus is starting again in our state. And today we're 0.90. So while our numbers look really good right now, we also know that there, as the as the governor said, there's a lot of turbulence in the water. And so as we look at these, that really guides us as we are back in this dance with the COVID virus. We want to go forward as much as we can safely. We're starting to be cautionary because as we come out, we know other states are starting to have more cases and more deaths. And across the country, we'll see that as people open back up again to some level. But with the governor's, vision and consistent focus on the health and well-being of our population, we will respond against this too. And there may be times that we have to stop or even go backwards or maybe even leave the dance floor for a little bit. So we're following a number of metrics. And I think it's important that folks in our state feel safe, that we see things that are happening that may then express itself in 7 to 14 days. And the governor is taking that into account as he's making the good decisions for the health and well-being of our state, economically, physically, and for the future. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Slimp.
Good afternoon, everyone. I probably need to start by echoing what the governor and Clay have both talked about, which is our nurses, and thank them for what they do in an incredible situation, incredible circumstances, and they every day continue to go back into, as the governor says, into the fire, and we thank them for that very much. We thank you all. As the governor also mentioned, we've created a COVID-19 advisory task force that is for African American issues that will help with public outreach and education as we begin providing testing for this vulnerable population in several areas of the state. We will be contacting individuals later today regarding their interest in participating on that task force. We greatly appreciate the assistance of Jill Upson, the Executive Director of the Herbert Henderson Office of Minority Affairs in the Governor's Office. Jill and her staff and staff from the Bureau of Public Health will assist this task force in their efforts. Dr. Slimp and her staff has been compiling and analyzing data for the past several weeks. Based upon that data, we have begun the process of establishing specific areas in the state where we will increase testing. Those areas include the Berkeley and Jefferson counties in West Virginia, Monongalia County in West Virginia, Marion County in West Virginia, and want to take a minute to thank the Marion County Health Director and the Health Department of Marion County for the good job they did in their efforts in the outbreak up there. Raleigh County, and perhaps some other areas of the state as we move forward and analyze this data. This testing will be done with the help of General Hoyer and the National Guard, utilizing mobile and drive-through testing. We actually have some county health departments that have also already begun testing the African American population, and we're looking forward to getting that data back. So they're increasing access to testing in several parts of the state. We look forward to working with the task force and the results of our efforts to address the needs of the African American population in West Virginia. That is all we have. Thank you.
All right, thank you both. Jeff Sandy, Secretary of the West Virginia Department of Military Affairs and Public Safety, is also with us today and is available for questions. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Phil Kabler with the Charleston Gazette-Mail.
I'm honored to go first. This question is probably for Dr. Marsh, but if the R0 is increasing over the last 3 days, wouldn't that predate some of the reopening measures that have been taken in the actually the past week and a half or so? What's causing the R0 to rise, and should we be concerned that it predates reopening of certain businesses and activities?
Clay,
Governor, do you want me to take that?
Yes, sir. Yes, sir.
So Phil, I think that as you look around the country, there is an issue of perception. And I think that indeed it's really important, and I support wholeheartedly the governor's commitment, as well as the president's commitment to try to help America get back to work and help people find their purpose again, and to create a bit of safety as we look at the impact of the economic downturn as well. But also, I 100% support the governor's commitment to the health and the well-being of our state. And I think when you look at other states, and I'm presuming there's part of this in West Virginia as well, that it may not be just the reopening, it may be the sort of the reframing, the perception that things are better now. We waited the COVID virus out and now it's good, and let's go back out, let's get together. And what we really know, and the governor has emphasized this even in his comments today, that all as we did by the flattening was buy ourselves more time. We're reducing the surge on the medical system, getting the ability to make more PPE, to be able to prepare ourselves better. But the virus is still there. We still have a very vulnerable population. And based on our numbers, it appears that very few people in our state have been exposed and infected with the virus. So we have a very large population that is immune deficient as well to respond to the virus immediately. So I think that the surge in Surge Romart, the increase in the R0 value may represent a lesser concern or consistent behavior for people in avoiding each other, staying home, doing the physical distancing. I think it's a reminder that we're not finished with the pandemic. In fact, we made it through the first quarter. This is a 4-quarter game. And as I said before, although we may be up a couple of touchdowns or a touchdown now going into the second quarter, we wouldn't stop playing the game. So it's really important that people continue to do the things that actually keep the R0 down, which really measures the speed of person-to-person spread of COVID-19.
All right, thank you, Phil. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Could you clarify where we are so far with the daycare testing? I know you said you're putting out the executive order mandating all of it, but it sounds like we've done a few, which is where those positives came up. How many have we done so far? How many more are there to do? And how long do we think it'll take to get that done?
Okay, I think Secretary Crouch and General Hoyer both need to weigh in on this, but maybe they could give you a better answer. Or maybe Dr. Slim,
Sure. Yes, we can respond to that. Kathy, do you have an update?
Sure. Testing is actively underway in most communities. Information is out. We've been fielding a lot of questions around it. And so it is well underway. We don't have a total number tested. It's really evolving. Again, this is an initiative that will continue to roll out because not every child care provider or every child care center is reopening right now. So we're testing the folks that are currently providing those child care services. We have well over 600 facilities, critical care facilities already providing these services to over 11,000 children. That's been happening the last few months. So we're testing those individuals that are currently providing that care as they expand out, additional individuals that are joining on staff. And then as some come on board over time, we'll be offering testing for each of those entities as they reopen. So it will not be a one-time fixed event.
All right, thank you, Charles. Next, we'll go to Amanda Barron with WSAZ.
Hi, everybody. Amanda Barron with WSAZ. I wanted to know what's being done to vet and verify the PPE that's now coming into the state is up to the standards that it needs to be, and that it's coming from verified vendors, so we know that our first responders are getting what they need.
All right, General Hoyer, this is you.
Yes, sir. Amanda, so when the governor established what we refer to as Task Force Peterson, which is the task force that goes out to pull PPE both from the stockpile as well as from vendors, a couple things happen. One is through the Fusion Center, there is a vetting of the various companies that we utilize. The second is the National Guard team that manages that stock of supplies takes samples of each of the supplies that comes in, and we are working with West Virginia University and NIOSH, a joint capability that they have at WVU, and samples of those PPE items are tested for their validity before they are put out into the field or into the stockpile for use for surge requirements. So based on the establishment of that task force, we implemented those things based on the governor's direction.
All right, thank you, Amanda. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. This might be for Jeff Sandy. I know this was asked a couple times yesterday about whether we had purchased the wrong masks. I know on the invoices said NIOSH approved N95 masks. It would seem that if we got these different versions with the ear loops that aren't NIOSH, it would seem that we did not get exactly what we had ordered as per our invoices. A number of other states have also received similar masks, and some have sent them back. I didn't know whether there is a possibility of, depending on how many we've already distributed, whether we ought to be trying to get them back, whether we ought to be trying to talk to the company, Ballard, in regards to the prices, considering that we paid in some cases, $5.60 some cents per mask for masks that don't even meet the same standards as 3M masks that are considerably less expensive than that per mask. Can you comment on any of that? Thank you.
Well, first of all, let's talk about the pricing. The pricing today is a lot different than it was at the beginning of the pandemic. So when we got those for $5.67 a piece, a lot of the places across the country were paying $8 to $9. Last night, we determined from the importer into the United States that approximately 75%, 150,000 of the 200,000 that we got from Ballard Safety were the NIOSH approved, 50,000 were the 3Xs. We are currently in the process of getting the data on the 3X masks. And again, as I stated yesterday, those masks are being used by first responders throughout the world. As far as going back to them, the prices that we paid at that point in March, I believe 23rd, when we got our first shipment in, that was for the NIOSH and other masks. Those were reasonable prices.
All right, thank you, Steve. Next, we'll go to Paul Mullen with WCBC Radio.
Paul Mullen, WCBC. I'd like to direct this to Dr. Marsh. What do we know about the virus today that we did not know 2 months ago? Could you do that without numbers? Kind of like, what have we learned over the past 2 months?
So thank you for the question. I think that we have learned that the virus is perhaps even more challenging than we initially thought. The spread is very rapid, and as we've said before, we learned that the spread can happen, at least as projected, maybe up to as much as 70% by people that haven't been diagnosed yet or are pre-symptomatic. That the highest titers of the virus are around the time of symptoms, which suggests that right before that, 0.5 days to 2.5 days, that people are infectious, and that's the reason why testing more broadly is important. We've also learned that the antibodies that we're now starting to try to get better tests for may not be there in the quantities that are effective in creating immunity in all people infected. And that is a concern because one of the thoughts initially was if you scan and you find people that are antibody positive, then these are people that would be safe to be back out with the virus. We're really now looking for quantitative antibody levels, which tell us how much antibody is there. We know that there's a drug, remdesivir, that does seem to have some activity against the virus, and it's an antiviral drug that was initially made against Ebola. It reduces the RNA polymerase that is necessary for the virus to get into cells and replicate, and so that's an important finding. And we know that there is some early work in a vaccine from the United Kingdom, from the Oxford University group, that can protect primates, rhesus monkeys, from getting a challenge of the infection, which is important. We also know that there is a mutation in the spike protein, which is part of the corona, that is the way that the virus enters the cells through a particular receptor that has mutated, which may make some of the vaccines less able to work against the other forms of the virus, and that's still being evaluated and evolved. The last thing is that when we first learned about the virus, we really targeted the data from China that said that the virus is really a virus that affected older people and really left younger people pretty much unchecked. And now that the virus is in the US, we actually know that's not true either. Although certainly as you get older and you have blood vessel problems, whether it's high blood pressure or heart disease or diabetes or obesity, that seems to be an important risk factor. We also know that a number of young people have been infected and have died in the United States, including infants, and that some of the initial presentations of the virus are really around blood clotting, and people can have strokes and heart attacks and kidney problems, and even foot disease now from the COVID virus. So we've learned a lot, but I think what we are realizing is that we are really early in our understanding of this virus, and although we've made a tremendous amount of progress, and we will continue to, well, the last thing we know is an Israeli group thinks that they found a monoclonal antibody, an antibody that can be produced in the lab that can actually block the ability of the virus to get into cells. And this would be a very exciting progressive opportunity for us if indeed that plays out. So we know a lot more about the virus, but we also know that we have a tremendous amount to learn, and learning to live with or dance with the virus is what we're trying to do currently.
All right, thank you, Paul. Up next, we'll go to Kenny Bass with WCHS.
Thank you. This is Kenny Bass with Channel 8 and Fox 11. Thanks to my daughter Casey, great friend Hallie, and all the nurses out there who take care of us for Nurses Day, including the nurse at the Capitol who takes our temperature. Thank you. I have a question for you, Governor. Some state workers have contacted me. They're getting emails about preparing to come back to work from their telework that they've been doing from home. They are not on the list yet to reopen, so do you have a ballpark on when state government offices would be reopening? And in line with that question, if they can work from home, be effective, be productive, still be able to take part in all the duties they need to take part in, is it time for us to change our way of thinking for some aspects of state government and continue to allow them to work from home to save not only on costs, but also to reduce their exposure to any lingering impacts that the virus might have?
Kenny, to answer the first part of your question, we're going to continue to watch the numbers and everything. We're still a few weeks out as far as the possibility of calling them back. As far as the possibility of working from home and matching the social distancing and all that together, I am completely open to that, because we've all got to realize that we're dealing with something here that no one has ever dealt with before. No one. And we're dealing with a pandemic that is a killer. And so we're going to have to adjust. We're going to have to change the rules of the game. And we're going to have to do that until we do one thing, and that is we bridge ourselves to a drug that makes this thing a common cold, or we bridge ourselves to a vaccine. So I am absolutely open to the possibility of being able to have people that can work from home to work from home, and we'll watch the numbers and we'll make that decision as we go forward.
All right, thank you, Kenny. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor and Cabinet members. Mark Curtis with 13 News Nexstar. We're hearing that the Kanawha County Health Department is going to hold a news conference in about an hour, and that the mayor of Charleston and that the president of the county commission will be there, and that they may very well announce that daycare centers in Charleston and Kanawha County will not be allowed to reopen. My question is this: if that happens, how can the economy open up in the state's most populous city and county if there's no daycare available for the workers?
Well, Mark, I don't know about this and everything, but the one thing that is out there that is just, it continues to happen. I don't know any way to say this other than just to tell you exactly what I think, but I hope and pray this is not another political stunt to draw relevance, to you and everything. We want to protect everyone out there, and we want to be able to bring our jobs back and everything, but we keep having the same thing go on all the time. We all can see through what's going on. It's nothing but the worst thing in the world in this kind of situation. I hope and pray this is not just more politics, and because we don't need this at this time.
All right, thank you, Mark. We have time for one more question. We'll go to Charles Booth with the Bluefield Daily Telegraph.
Governor, this is Charles Booth with the Bluefield Daily Telegraph. As you know, the Hatfield-McCoy ATV Trail runs through southern West Virginia. It's crucial for many related businesses. This prolonged closure of the system, they are struggling to survive and unable to book reservations and losing money every day. Can you give those ATV business owners a target date for reopening Hatfield-McCoy?
I'm really working really hard on that because I totally understand completely what you're saying. And I am really hoping that what we're going to be able to do is give you real guidelines on the Hatfields and McCoy's trail, or trail systems and everything next week, or the early day, or maybe even the latter days of this week. But at the end of the day, what I am extremely hopeful of is that those trails can open back up and the cabins and everything, because I've got all the confidence in the world in the people in southern West Virginia and all across this great state to be able to clean those cabins and to work with our people and to keep us safe in every way possible. I truly get the economics, and it's an outdoor activity. The only thing that is suspect about this whole thing is we know there's a lot of people that come to those trails and will come to those trails from a neighboring Virginia that's under a stay-at-home order or whatever, that may be a little more strict than what we've got, and then that exposes us. We've got to absolutely know and monitor that level of risk and everything, and I'm all over that because, believe me, I know that area of the world as well as anybody, and I understand exactly what we've got to deal with, and we'll give those people a date, and we'll give those people dates really soon.
All right, Governor, back to you.
Okay, I guess, all I've got is just real quick stuff here. The food bank in Huntington, absolutely having the mobile food bank that serviced with our great National Guard, 198 families. I love that and love it to death, and I commend them in every way. Again, I want to circle back to the fact that our nurses and all the great work they've done, and I hope and pray some way, somehow they'll know that all of us love them and appreciate them, and we have them in our prayers and thoughts all the time. I want to again circle back and thank the experts that we have working with us, and there's so many. But just on this call, if you look at Secretary Sandy and Secretary Kraus and Dr. Slimp and Dr. Marsh and our great General Hoyer and all the great work that they do, but all the people that are below them and their disciples in every way, it's unbelievable the great work that's been going on in West Virginia for a good amount of time here, and I commend them and I thank them. Now, I want to just tell you just this, and this is exactly how I feel. But on one hand over here, you've got the absolute safety of all of us to the best of all of our ability. And on this hand, you could probably say is risk. And we have managed that risk in West Virginia in an unbelievably good way because of you, West Virginians. That's all there is to it. You know, we can come up with all the guidelines in the world and tell you, but you, West Virginians, have managed the risk and you have done unbelievable. That's all there is to it. It's unbelievable. It's just an absolute miracle. Now, on the other hand over here, if I could just be bold enough to tell you just point blank, if we do not, as a nation, go back to work, we're going to slip into a depression. It's not going to be a recession. It's going to be a depression. And if that be the case, then we're going to have neighbor against neighbor. We're going to have food issues. We're going to have so many people die, it is unbelievable. Now, this is tough stuff. You've got on this side, you've got the risk of this virus that is still with us. And on this side over here, you've got depression. Now, you've got to manage that. Somewhere in between here, we have got to find some happy medium. Now, the one thing you can do, West Virginians, is just this. You can move us towards being able to do more and be able to go back to work more and do more to prevent us from slipping into an economic catastrophe in this nation by just being smart, by just being what you've already been. You can allow us to manage the situation, to manage the risk, to manage the situation, because there's risk by sitting home on the porch. You know, we've made the right moves and we have pushed the right buttons. We made the right moves in the very, very beginning, you know, denying visitation to our nursing homes or declaring emergency orders or canceling our schools or all the different things that we did. And then first in the nation with testing all of our nursing homes. And now we're wanting to mandatorily test our daycares and our assisted livings. And we as West Virginia have really done good stuff. But you are who we've got to have to be able to manage the risk. Because as we move away from where we are today and try to go back, if we don't manage the risk, bad things will happen. And if we're not able to go back, bad things are going to happen there too. It's a heck of a situation, and it's really tough. And it's only going to be tough until we get the bridge to a drug that enables us to be safe. So please, please, West Virginians, just do what you've been doing. Absolutely, we're going to absolutely crawl before we run, and before we allow you to be able to do more and more and more and really potentially raise the risk level to a level that we can't handle. So as we go forward, please just take heed of what all these great experts have said. You know, I've tried to tell you from my heart as best I possibly can. I'll never tell you anything but the truth. And I absolutely would try to protect you with all my soul. And I'll try to perpetuate West Virginia in every way I possibly can. God bless you and thank you so much. But please, please, please listen. Please be concerned. Please take care of the elderly. And please just continue to do the right stuff. I'm really proud of you, but thank you so much.